Welcome to Deciphering Growth, the show that explores mental health from every angle. We bring you conversations with personal opinions, stories, and practical tips. We aim to break down the stigma and help you live your best life. So please sit back and let's dive in. Before we begin, we want to remind our listeners that this podcast represents the opinions of Tiffany Graves, Eric Stone, and the show's guests. The content provided is for informational purposes only and should not be considered medical advice. Please consult a healthcare professional for any medical questions. The views and opinions expressed are our own and do not represent those of our workplaces. Listening, reading, emailing, or interacting on social media with our content does not establish a doctor-patient relationship.
All right, we are back with a potentially very spicy topic today. Eric, you want to introduce our topic?
Yeah, we're in the midst of a lot of political things for mental health funding, addiction funding, prevention work, healthcare funding. So obviously Tiffany and I are more in the mental health substance use space than the other spaces of healthcare, but we really want to talk about this. We think it's important, but we will put a disclaimer that like we are going to be critiquing some policy changes by the current presidential administration and some of the impacts that has. So we're just going to try to talk about some of the facts, some of the reactions, but there is a lot going on in the world right now. So Tiffany, I mean, I know that we've talked about this one. We always try to be mindful. Um, but what would you, anything just so far, Tiffany, you would throw out as we're just kind of gearing up for this one?
I think the biggest thing is the reminder that therapy is political. We're not trying to tell you to lean one way or the other. We're not trying to be dismissive of anyone's beliefs or values. We're just trying to point out some of the pain that these policy changes and things that are happening can be causing to individuals.
So one that has a lot of people concerned. I mean, I live in Ohio. Tiffany and I live in Ohio. We work in
I
the
live in
Ohio,
Kentucky, so
Kentucky. I'm sorry. I'm sorry, Tiffany. I
it's
just
okay.
consider you such a friend that I'm like, we're
I work
basically
over there though.
neighbors. Tiffany does not live in Ohio. BT dubs. We're not going to edit that out because that's going to be what I have to hear about later. No, I'm just kidding.
They're gonna find
Um,
me. They're gonna be like,
they'd be like, where is it? No, I'm just kidding. No doxing on the podcast today. But we're kind of more focused on local, but local in this area, there's been some discussions at the Ohio state level, but also the federal level for work requirement for Medicaid. Uh, so some of you may not have Medicaid, may have not had Medicaid, but it's something for low income folks to low SES to have access to treatment and access to all types of things. We're not even talking mental health care. We're just talking basic health care. Um, so I know Tiffany, if you have any stats ready, um, but I'm excited about this topic to discuss.
I have I don't even know if they're stats. I'm not good with numbers, guys. Not even gonna lie about it. I don't think I have stats. I have more of like policy change, federal funding kind of.
Okay. Well, let me throw out some stats, just why I like a little bit of mental health, a little bit different things. So Medicaid covers more than 40% of the births in the United States. So that is it's a huge stat. Like that is a gigantic number. So any changes to Medicaid, that is impacting about almost half of anyone who's giving birth to a child. When we're talking about Ohio, I didn't come ready for the uh, stats, Tiffany, on Kentucky, so my B. I'm sorry, Kentucky. I do love you guys. I love your Bourbon Trail. I love Red River Gorge. I love Ale8 suckers. I definitely
They
connect
make
with my.
suckers? What?
If anyone has not had an Ale8 sucker, it'll change your life. So I signed my name to that as we record this. But I did look up the stats for Ohio. So Ohio Medicaid, as of August 2024, we're talking 3 million, almost 3 million Ohioans, and that would represent about 21% of the population. Uh, so sometimes I think when we have some of these discussions, people get a little spicy, whichever experience, but we're just kind of talking a little bit about statistics and what is helpful and what is not. So, just going over some stats here. So, according to the National Institute of Mental Health, over 1 in 5 adults live with a mental illness. That's 59 million Americans. Meanwhile, there's more than 106,000 people have died from drug overdoses in 2021. Now, drug overdose deaths have gone down, but that's a little bit about what we're going to talk about today. They've gone down because of many wonderful grants and funding to get overdose prevention, like naloxone, um, all over for free, all over the state. So um, it's something that I think that we don't appreciate because we don't remember it not being free. There's been a huge push, but it is also way cheaper to spend $50 on some Narcan and have that for someone available to use than send an entire ambulance, sometimes a fire truck, maybe even a police officer out to the scene of an overdose. Uh, so some of this, it's like I think we look at how much we're spending, but also the good it's doing. And so this is something that may kind of sound silly, Tiffany, but they've almost done too good of a job preventing, as much as I can say this, because the numbers haven't increased. So it's like, well, hey, they haven't decreased either, but it's like just the sheer number of people using substances, the sheer number of all of these analogs that get mixed into the drug supply, and you can't test for them right away. Uh, you know, but this overdose prevention works. Deaths are down despite so many things going out there that could be a killer. And so without this funding, it's going to get really dire. I mean, truly, like decisions like, well, who do we give this Narcan to?
Mhm.
Who gets this? And that gets really scary. So I don't want to go too off tangent, but I do want to talk about the practical meanings of this data and what it means, because this is going to impact who lives and who dies in a lot of different ways.
Yeah. Yeah. It's gonna be heavy for sure.
Few other things that kind of relate to the mental health industry specifically. We are in a youth mental health crisis. So, CDC data from 2023 showed that 42% of US high school students reported persistent feelings of sadness or hopelessness, and 1 in 5 had seriously considered suicide. There's a lot of pending funding that is going to be pulled from the COVID era by the current presidential administration, because it's about, I mean, we're talking, I think it's $1 billion is what's being proposed to be pulled, that has funded more mental health counselors in schools, more prevention work, programming, outreach. And one thing that will get me pretty fiery is when there is a tragedy and someone's in a crisis moment and hurts other people, hurts their community. Very often, Tiffany, I know we've talked about this off mic, what is referenced is, oh, well, it's a mental health issue. It's a mental health issue. It's not this, it's not that, it's a mental health issue. So I don't understand the logic behind defunding something like this. That is prevention work. I believe my social work brethren have taught me some statistics, but every dollar of prevention work has a wonderful return of almost like $1.30 off of, like, when you're talking about the healthcare costs. So funding mental health helps lower the costs to our cities and our towns. That you are spending money, not to get too off track, but you're spending money to make money. So yes, you're spending money on the social worker to come out and help them. You're spending money on the case manager to help schedule appointments. But you know what happens when they find housing and they find supports? They become back connected to our communities. And when they're connected to our communities, they're more productive. So all this is very holistic. And so I just think they're cherry picking some stats to make it look like the funding has not done anything. I think it speaks to how needed that funding is, that despite putting that in, uh, there is not a significant change. So critics could say, well, if we're spending this much money and it's not getting better, that's a waste of money. I don't believe in that, and I don't want to give an extreme example, but we are funding research on so many different diseases. We haven't found cures to some of these diseases, like cancer or other different um, autoimmune diseases, but that doesn't mean that that money is wasted. If we're finding different things, we're getting closer in the journey. So I will say that I do find people talking that way about the funding very triggering, because we're not talking about Excel sheets. We're not talking about, oh, this number went up, this number went down. You're talking about a family. You can fact check me, Tiffany, but I think one of the stats we talk about a lot, if someone dies by suicide, 130 different people are
Mhm.
impacted directly by that person having that event. And then knowing someone directly connected to you that dies by suicide increases our own risk of suicide. So this is very
It's a
this is
ripple
very
effect.
serious. Yeah, I mean I'm pumped. I'm coming a little spicy. But I just want to I want to talk for real. I don't want to talk about Excel sheets. Not that you're doing this, Tiffany, but numbers, sure. We all want to have money and not spend money doesn't go in, but like you're putting a dollar amount on different things. And so I know I've been talking a lot about Butler County veterans, but we have lost in Butler County 8 veterans to death by suicide. That's more already than all of last year. It was 7 for all of last year. We are already at 8, and that puts them at 9, and a veteran in Butler County at 9 times a higher rate than a non-veteran dying by suicide. That is an appalling statistic. That's a horrifying statistic. So I want to understand in that case who is saying to defund 988 or some of these
Mhm.
different services for veterans, get less counselors. Like I want to talk to them. Like I really want to understand, like, do you just not care? Or do you
Yeah,
think that's not worth that money? Because either way, I'm going to fight you on it. But I just want to know where they're coming from.
yeah.
So I don't know.
Yeah, that was one that it was on my things to talk about, where the 9/8 lifeline for LGBT and other individuals and youth, that suicide crisis hotline, despite having over 1 million contacts since it has been established in 2022, it's something that they just don't consider um, to keep. It has been the budget plans to eliminate that specialized crisis support. And then I didn't fact check this aspect, so I'm just gonna put that out there in case I get fact checked. I remember hearing something on the internet of where Canada was offering to provide a support line in the instance that this line gets eliminated.
I
So
think I saw something like that, but I also can't.
yeah, I was like, I can't fact check it because I didn't actually have the time to, to
I
go.
actually can't fact check.
But yeah,
um,
yeah.
no,
Then
I mean,
there's
go
also
for it.
the NIH grants, where the Trump administration has canceled 694 research grants totaling 1.8 billion, which significantly affects studies on minority health, LGBT health, and COVID-19 type health concerns.
Oh boy.
Yeah. I mean, it's already minority health and LGBT health are underserved, and now we're just like, let's make them even more underserved by like ripping these grants away from people.
So I mean, we're talking billions, like, which is just such a big number that we don't have time to break down what a billion really is. But you're right. There's been a 30% reduction amongst a lot of research looking at suicide prevention, trauma,
Mm.
opioid use, co-occurring use. There's also some concerns about the opioid settlement funding. So there's this website, if anyone's interested, opioid settlement trackers. So with the opioid crisis, there were billions of dollars that all of these pharmaceutical companies had to pay and put in, but the stuff that's probably going to make a lot of people angry is only 34% of that money is going towards direct treatment or harm reduction. So a large amount of those funds have been diverted into general budgets or law enforcement. Now, I understand that some are like, well, hey, that money's to do prevention work or going, but whatever that percentage, I think we could probably argue 34% to treatment and prevention is and harm reduction is probably not enough of that percent of what is being spent. Um, we also need to talk about a lot of these clinics that are seeing Medicaid in rural clusters. I know we can't, well, we could, but we won't spend hours here. But there's been a healthcare, like a rural healthcare crisis. So in these areas that are more remote, we're talking 90 minutes from a major metropolitan city.
Mhm.
They struggle already to keep any type of healthcare organization running. It's not profitable, but we know that people need healthcare in these communities. So in 2024, there were already 200 community behavioral health organizations across the whole country that were shut down. But rural states were getting hit harder, like West Virginia and Montana. So if there are any, let's say less reimbursement for Medicaid, there's any cutting that number down significantly, that is going to close more clinics and more sites, which also just means in this stat, emergency departments are already overused. So
Mhm.
mental health visits to ERs have increased by 44% since 2019. Somebody may say, well, hey, some of that could be they know where to go. True. But that's not a very it's one can try to be trauma informed of the ER, and I know some great ER healthcare workers, but like that's a very traumatic space for someone to work in, to be in, and if you're in a mental health crisis, you can lie even if you get there, and so it
Mhm.
becomes very triggering, and that's where that term healthcare trauma. We could think about things people are going through, but I mean, I shudder to think about what happens if there's even less clinics and then even more people are going to the ER for anything. Uh, that wait time, I mean, the wait times are measured in the hours. So what does that look like when there's even more people coming in for mental health reasons alone that maybe a outpatient clinic could manage?
Mhm. Yeah, and on top of that, rural areas tend to have more individuals on plans. And with that Medicaid overhaul you were mentioning, that's going to impact like 8.6 million Americans. So if, worst case scenario, they lose coverage, there's another barrier in place for them to receive and find ways to seek services.
That part, I'm concerned about a lot of things, but like as a therapist who sits with people who have major trauma from going through some of these healthcare places, um, it's just tough. And listen, there's some great I don't want I really want to make sure no one listening thinks that I'm bashing. I really appreciate them. They're covering so many things and doing and keeping people alive, saving lives. It's like I'm very grateful. In Butler County, we have 5 different ERs, which is amazing for the area we're in. I'm scared to think about there's some specialized training we all kind of need to support different things. And so if you're sending more of a different type of specialty, maybe they do training, but they're not set up to be a mental health specific urgent care. Most are not. They're trying to cover so many things. So combine that with a Narcan shortage in our area, Ohio, Kentucky, Indiana, they're predicting having to cut back on Narcan distribution by about 60%. Combine that with the $1 billion decrease in school mental health funding, they're estimating that that means 5 million students will no longer have access to school-based counselors or psychologists off of that funding changed.
That's
Um,
so fucked up.
it really is. And I think the thing that really gets my goat, I think mental health is important every day. Tiffany and I were just talking about our own personal wellness before we started recording. I am going to lose it the next crisis because no doubt there's going to be another one. And the next one, when it's like, oh, we should do mental health or this is mental health, like you can't say that mental health is a priority or the solution to that when you're cutting funding or matter of factly, if you know that and see that and don't care, then you're saying those lives aren't worth saving, whatever that cost would have been, which is really, I just, yeah, yeah,
It's a shit show.
it is.
Yeah.
So some states are joining lawsuits to try and push back on some of these cuts to funding. Community Care Continuity Act, which would restore the Medicaid funds for behavioral health, kind of try to have some stabilization grants. So if there are some changes that these agencies do not close unexpectedly. Um, but we need to be talking about some of these things. Like some of us may not have Medicaid, but it directly impacts. So
Mhm.
these Medicaid clinics are also serving more than those who have Medicaid. So even if they're gone, there's less options. And it's just a mess. I mean, I don't know if you're hearing from your patients, Tiffany, but I keep hearing about like it's getting harder and harder just to find somebody that takes your insurance and can go and find it and use it. And I mean it's very tricky. And so I'm disappointed by insurance companies, to be blunt, because they are not trying to solve these problems. If I can be blunt, they are more, I won't say they're creating these problems, but I think they're okay with it being a little harder to find to a certain point. I know someone say, no, they're there to help, but we can be honest, like there are some things that are set up for insurance companies that do not help customers or
Mhm.
patients. Um, they
Yeah.
don't. And I say customers because they're paying for their health insurance, or they are the ones with their own insurance, and like they're not getting benefited. There are lots of things that benefit the company that do not benefit client care.
Yeah, which that just kind of rolls me into the mental health parity rollback that the Trump administration has suspended enforcement of a rule reinforcing the Mental Health Parity and Addiction Equity Act. Um, so essentially what this means is refers to a reduction in enforcement of the rules meant to ensure equal treatment for mental health conditions in insurance. So under the mental health I'm gonna butcher this word every time. Party, Parity and Addiction Equity Act, the MHPAEA. Insurance companies are legally required to provide mental health and substance use disorder benefits that are no more restrictive than physical health coverage. So an example is if your insurance covers unlimited doctor visits for diabetes, it must do the same for depression, anxiety as well. So, but this rollback means that the federal government is stepping back from actively enforcing this rule. So insurance companies might be able to place limits on mental health treatment, like fewer therapy sessions. They might require prior authorizations before they even allow you to see mental health providers. And they might not even provide reimbursement at all for behavioral health services. And this is just kind of really going to, again, chop us off at the knees in terms of being able to provide services for people who like can't afford it, but can to some degree if they're using insurance and using that as a way to like gain access.
Wow. It's a scary time. This is some stuff that I didn't think we would be going back on after uh what had been discussed, but maybe I should not be surprised.
Hmm. Yeah. And then you might be familiar with the Department of Health and Human Services where they're restructuring that. So they're cutting around 10,000 jobs, they're downsizing programs, they're combining services, they're reducing the spending of that by 1 billion annually. That group and department covers Sam Samsa? I don't know how you pronounce that. The SAMHSA.
Oh yeah, Samsha. Yeah. Yeah,
Samsha.
yeah, sorry. I thought you said it right, so I was like, "Oh wait. Oh wait."
And then Medicaid, Medicare, the CMS program, and the NIH, the Health Research and other programs. So there's just ultimately will be slower response times, fewer services, less support for public health programs in general, um, and possible delays in funding, if any funding, and mental health and substance use services.
Wow. Wow. Yeah, that's the main stuff I came prepped to talk about is like some of the things going on, some of the stats, why it should matter. And
Mhm.
I challenge anybody who doesn't directly know someone impacted by this that it really matters. I mean, um I honestly think veteran stuff is really just kind of tragic. And I think I talked about this the last episode with the VA where they're having to give a disclaimer right now of we can't guarantee your privacy.
Mhm. Yeah. I
Just a
will say
wild
though,
time.
you were talking about Ohio. I live in Kentucky, and Kentucky is, I haven't fact checked whether or not it's passed, but they are working on a behavior health and substance use treatment fairness bill to ensure that insurance companies still cover mental health and substance use services in Kentucky, and things of that nature. So even though the United States is on fire, some states are still trying to make sure these things don't go away for the people within their state.
Hmm. Well, Tiffany, is there anything else on your end that you were like, okay, this is stuff I want to talk more about?
Yeah, the only thing, I wouldn't say it's a lot, but the little thing that I did want to like bring up and mention, so that we can kind of give anyone listening ways to help out, ways to like find a voice, ways to speak out. There's the two that I like is the oh my gosh, words this morning. The Trevor Project, which is a really good um project organization that helps support LGBT access to mental health for youth. And then there's the ACLU. And then there's another one I can't think of, but it focuses on equality, where you can go and you can donate. I know the ACLU even gives you um, pre-written emails and phone scripts if you want to like call your representatives and things of that nature. So just a few ways that you guys, like those listening, like if you haven't figured out how to have your voice heard, you can use those things. You know, not saying you have to, but we would encourage you if you feel strongly about mental health.
And keep the conversation going, like make people defend their positions, it works. I mean, Butler County, we just passed our library levy because people were like, wait, no, we love our libraries. And then if you look at the state level, people are like, we love our roads. Now, I know there's a lot of people who hate on Ohio roads, but I love my Indiana family. I love my time in Indiana. But I promise you, if you want to see how good Ohio roads are, just drive into Indiana. That's all I'm going to say. That's all I'm going to say. Because literally, as soon as you drive over there, you're going to be like, oh my goodness. So I appreciate our nice roads and libraries. I hope that we also have nice therapists that we can go see too to appreciate our nice roads. But I just want to say it matters. So keep the conversation going. Keep advocating. Um, you know, I think what's the best quote? Democracy dies in darkness. So just keep the conversation going. We don't all have to agree. Lord knows Tiffany and I don't agree on everything, but that's okay. Like we can have great conversations. We see a lot of things the same. But I don't know. Maybe I'm delusional, but I think civil discourse is beautiful. I think we should be able to get along with each other and have some conversations, but also we can call some shit out, and that's okay sometimes. It's okay to need to be able to be like, hey, you're way out of line. That's not right. Uh, so have some of those facts, have some of those stats. If anybody has a particular angle they'd like us to look into, but we are trying to do our part of pushing a conversation forward.
Yeah, I think that's the biggest message to leave you guys with is just do your part. And yeah, and we will see you guys next time. Well, I say see you, but like we literally will.
Oh, we'll see you. No, I'm just kidding.
Thanks for tuning in to this week's episode of Deciphering Growth. We hope you found our conversation helpful and insightful. Subscribe to our podcast for more episodes and check out our Patreon for more content. Don't hesitate to contact us on social media if you have any questions or comments. We'd love to hear from you. Until next time, keep growing.